my name's Stephanie and I'll be presenting on behalf of our research group to communicate the preliminary results to phase 1 of our ongoing study evaluating non-antibiotic products to prevent and treat urinary tract infections. There are no disclosures relevant to this study and it's been reviewed and approved by the relevant ethics committee. So the prevalence of urinary tract infections in women places it among the most common ailments encountered in medical practice. Acute uncomplicated cystitis occurs in 50 to 80% of women, and 30 to 44% of this group will have a recurrence soon after. This translates to large amounts being spent on diagnosis and treatment, as well as a related reduction in workforce productivity. UTIs are not only responsible for high morbidity, but they're also a main cause of antibiotic prescription. Rising antibiotic resistance, driven by overprescription and overuse, has meant a decline in the effectiveness of antibiotics in treating urinary tract infections. This has led to clinicians and patients alike exploring potential non-antibiotic options. Therefore, this study aims to gain more information on this. As a primary aim, we sought to survey women's use and knowledge of non-antibiotic products to prevent and treat UTIs. The secondary objectives included evaluating the knowledge and attitudes of women regarding CAM therapies, also women's perception of healthcare practitioner attitudes to CAMs. This involved using a cross-sectional questionnaire-based survey split into 2 sections. The first part focusing on demographic information of participants, their knowledge and attitudes to CAMs, and their experience using them. The second section included the validated CAMBI questionnaire to gain a bit more of a general perception of women's willingness to use complementary and alternative medicines. The table shown here is an excerpt of section A of the questionnaire, asking about which therapies women had heard of or tried and which they found to be effective. Roughly 150 participants were recruited from each of the following 3 groups. So those attending a hospital-based tertiary care clinic for problematic bladder symptoms, those attending for non-bladder related problems, and lastly, those responding to a request on social media. So moving on to what we actually found, those in the social media group seemed to be younger and a greater percentage had tried non-antibiotic products. As well as this, in total, the social media group had tried a greater number of unique CAM therapies combined compared to both of the clinic groups. Those who were recruited from the non-bladder clinic group were less likely to have suffered with a UTI, with more women noting that they'd experienced 0 within the last year. Those in the social media group and bladder clinic group were more likely to have suffered from 3 or more UTIs within the past year. As mentioned, the social media group had a more broad range of non-antibiotic therapies compared to either clinic group. In total, women in the social media group had tried 53 unique non-antibiotic treatments for UTIs, compared to 7 in the non-bladder clinic group and 15 in the bladder clinic group. These can be divided into the broad categories shown here. So for example, fluids related to women increasing their fluid intake, while dietary modification was commonly around decreasing sugar intake. Fluids, herbs and plants, and the addition of specific fruit and vegetables seem to be the most common CAM therapies used. Overall, 31% of women surveyed thought non-antibiotic products were effective in preventing or managing a UTI. Of this group, 63% in fact specified cranberry as being the effective substance, indicating that it might show promise in the future. So this slide combines results for both groups and illustrates the results of questions around women's knowledge to CAM therapies. Most women would recommend non-antibiotic products to a friend, and the majority would like more information from a healthcare professional on non-antibiotic products for UTI management. The CAMBI questionnaire results didn't seem to differ between groups, as shown by this slide, with the statement, Patients should take an active role in their treatment, as an example. Overall, women agreed with this statement. Similar percentages showing agreement were seen with the phrase, treatment should be non-toxic. So to conclude, most women had tried non-antibiotic therapies for UTI management, with cranberry products being the most common. The younger online cohort, who had a higher incidence of recurrent UTIs, were more likely to have tried alternative therapies. This could be for a variety of reasons, age, or if they were more symptomatic. Only 1/3 of women surveyed felt that non-antibiotic therapies worked. However, 60% would still recommend them to a friend. Overall, the women surveyed believed in non-toxic, natural, complementary therapies and taking an active role in their treatment. There appears to be an unmet need for information about non-antibiotic products to prevent and treat UTIs. So thank you very much for listening, and feel free to leave any questions. We hope that you enjoy the rest of the conference.